Okay, so confusion and paranoia, I already set the stage for this. Hallucination and paranoia are probably provoked by being in an unfamiliar setting, exposure to new medications, and disruption of the sleep cycle, and or the presence of an infection or whatever reason brought you to the hospital. And it can occur in people who've never had it before. And so I want people to be on guard for it, not scared of it, and also know that it will probably go right away once you get out of there or whatever medication is provoking it occurs. We know the bad guys are strong medications, sleeping pills, anxiety medications, and some of our medicines for Parkinson's disease. So people taking Artane who are getting hallucinations in the hospital, that might be a good one to reduce. Amantadine also might need to be reduced during hospitalization, and sometimes dopamine agonists. If you are confused, besides reducing these kinds of medications and making sure that you don't have an infection, treatment with some of the very new antipsychotics or that are of a special breed, like quetiapine, which is Seroquel, or Clozaril, which is clozapine, those medications can help control hallucinations without making your Parkinson's disease symptoms worse. And that's also in the handout, so don't have to write it down. There are medications like Aricept that's used for cognitive impairment in Parkinson's disease. I wouldn't stop it if you were hospitalized, because I think it's probably helping. But it would probably be, if you're only hospitalized for some days and you're having hallucinations, it's probably hard to get going on that medications right away. So I think if there's an immediate issue of concerning hallucinations or paranoid feelings, Seroquel and Clozaril are probably the best ways to go there. And I mentioned before, if everything else is going okay, your joint's okay, your infection's under control, but you're still kind of confused, the best thing to do may be to get out of the hospital to rehab or home with some help. Okay. Some people in here have deep brain stimulators, and you know more about it than a lot of people in the hospital. And you need to tell them that you've got deep brain stimulators if you're going into the hospital, because those things are doing funny things to any kind of electrical measurements that are made on you. So for example, EKG, EEG, they're uninterpretable with your deep brain stimulator cranking away. So you are in the best position to know how to turn it off. Many technical people within the hospital don't know how to do that. So if you're scheduling to go into the hospital, or you're going to be far from your house, it's a good idea to have the device around the controller or the magnet so you can turn it off. The other thing is sometimes people get heat pads, or there's something called diathermy, a way of helping with aches and pains. Those things should be kept away from you if you've got a deep brain stimulator in place, because the wires act as an antenna, and the energy from that heating device can be transmitted up the wires to your brain, and that's not what you want to happen. So, and that even if you turn it off, diathermy is not safe for you. So hot water bottles are better. This applies to surgeons too, because they often use electrocautery, or sort of heat an electrical energy in the operating room, just to help clean up the surgical bed and get rid of any kind of bleeding. But they need to know you've got the deep brain stimulator in place, so they can think about where to put the ground on your body, and it should be far away from the deep brain stimulator wires. Okay, and then MRIs. Once you have deep brain stimulators in place, you're a different person, and MRIs should only be done by people who really understand that you've got the deep brain stimulators in place, and know the risks involved there. Head MRIs are generally okay. The rest of the body, they have to be knowledgeable about it. So here's the flip side. These are ideas to keep you out of the hospital. Keep up your level of exercise and stretching. Don't fall. So use your noggin about going up and down stairs. Use your railings, and don't carry down television sets. let your doctor know, don't hide it from him or her, that you're having occasional hallucinations. If it's getting worse, we want to know about it so we can adjust your medication so that you don't get really confused one night and get yourself taken to the hospital. If you're choking more, or if you're beginning to choke, bring it up, because sometimes speech therapy and swallowing therapy can be useful in overcoming this kind of problem and coming up with solutions to help prevent it. Don't be stoic. If you have a fever and it's more than a little fever, or you feel ill, don't sit on it on Thursday and Friday afternoon. Get evaluated sooner rather than later, because if you have a little pneumonia, we can take care of it with oral medications at your home. If you have a big pneumonia, you got to come into the hospital. So we like you, but we want to keep you at home. And this is, where a good relationship with a primary care doctor is very important, because neurologists aren't good at what I just was describing. For those who live alone, devices that put you in direct contact with medical personnel may be desirable. We hear about people who fall down in a part of their house and they have trouble getting back up, and just being down for 6 or 8 hours in some extremis could prolong a hospitalization that might not even be a hospitalization if you're able to connect quickly to medical care. So having a way of connecting to medical care if you are having more advanced Parkinson's disease may be a wise move. Okay, so what I just told you was theoretical, but now here's a study looking into it. A 6-year study in Tel Aviv looked at hospitalizations, and in that study, 37% were admitted for motor complications. That's pretty unusual here. But as they were doing the study, they changed the way their clinic worked, and they started having an open door policy. And they found that in the latter parts of their study, many fewer patients were admitted for Parkinson's disease because they were getting taken care of in the clinic. And so that's a newer idea, a newer model to try to address things as an outpatient to keep people out of the hospital. And so this is on the minds of Parkinson's disease neurologists, and it's on the minds of people thinking about delivering better care to everybody to improve hospitalization and to also avoid hospitalization. And so we're thinking about ways of developing automatic systems to warn healthcare providers about possible interactions of PD treatments and Parkinson's disease patients. So avoiding bad anti-nausea pills, avoiding bad antipsychotic medications. We're trying to get hospitals to allow for more flexible medication schedules, and we're trying to work with local and immediate hospitals to educate them about the special needs of Parkinson's disease patients, and to change the way that clinics are scheduled so that they allow for drop-in or more urgent visits. So to conclude, Parkinson's disease patients may be safely hospitalized, and I was actually very encouraged by the hand showing there. I hope it was the truth. People with Parkinson's disease should expect temporary worsening of their symptoms and a slower rate of recovery, but oftentimes they're actually just as good as patients. But they need to have in mind that it could be a little bit worse for the short term. It's important to alert medical personnel to your diagnosis so it can be kept in mind during the hospitalization, and allow for them to choose the right medications for you, and also sort of think ahead to what is the best way to do rehabilitation if necessary. You have a list of medications that should be avoided, and it's good to share it with anesthesiologists before you have some procedure, or with a surgeon who's not so familiar with Parkinson's disease symptoms. So it's something to take with you. And for people who are taking monoamine oxidase inhibitors like rasagiline or selegiline, meperidine should be avoided. We talked about the timing of medications as late before your procedure and as soon after your procedure as it can safely be given, and to expect a full recovery. But perhaps a longer recovery period. If deep brain stimulators are in place, please bring your device. You need to turn it off if you're getting an EEG or an EKG, and there's special concerns if they're thinking about doing an MRI. I want to thank you for your attention, and I think questions will come after the end of the end of this second session. Thank you.